Hello, my name is Cynthia Dalton. The policy analysis assignment that I've chosen to focus on is the North Carolina Sexually Transmitted Public Health Program Manual Policy.
As an overview on the CDB, North Carolina CDB purpose is to reduce morbidity and mortality resulting from communicable diseases. Its goal is achieved through detection, tracking, investigation, control, education, and care activities. It is a subordinate of the epidemiology section. The Division of Public Health. This division is responsible for reducing mobility and mortality resulting from communicable and environment diseases and conditions.
Now, I would like to talk to you about the background of this health policy analysis, which will be discussed more, emphasized more in the slides that I have prepared for you. The STDs has been increasing, and we have not done well with controlling the issues associated with the STDs. As a result to our failure to deal with these public health problems in a straightforward and effective manner, the prevalence of STDs is high, and the economic health impact of STDs is enormous.
Background. STDs in the United States reached a record high of 2,295,739 cases in 2017. Worldwide, more than a million people are infected with a STD daily, with the highest burden being low income countries. STDs does not refer to any one disease, but includes more than 25 infectious organisms that are transmitted through sexual activity. Each year, there are an estimated 357 million new cases with one of four STDs: chlamydia, gonorrhea, syphilis, and trichomonas. More than 500 million people are estimated to have genital infection with herpes simplex virus. The majority of the STDs have no symptoms or only mild symptoms that may not be recognized as STD. The guidelines for treatment of persons who have or are at risk of STDs were updated by the CDC after consultation with a group of professionals knowledgeable in the field of STDs who met in Atlanta on April 30th, May 2nd, 2013. So, my problem statement for this assignment is: what further action should the North Carolina Department of Health and Human Services Division of Public Health take to prevent sexually transmitted disease?
Landscape. I will be identifying multiple key stakeholders with this analysis. The provision of accessible, acceptable, and effective care service is a cornerstone of any program for the prevention of STDs, and multiple stakeholders, as I said, is incorporated with this policy. We have the health departments, our local health departments, that we definitely have to stay in contact with. We have the governmental organizations, the healthcare, and the healthcare sector is like including clinical providers and the third party payers. We have the academic institutions and the biomedical scientists, to make these medications that we need to help cure these STDs, the curable ones. And we also have specialized STD clinics, like the one that I work in as an HIV specialist. Um, we have, and that's me, the outpatient specialist. We have first level care, including emergency rooms and other healthcare centers. We have the reproductive health, maternal and child health clinics, family planning clinics, and we also must include our health insurance policy, a non-governmental organization and community groups, and policy makers, and also the pharmacy industry as well. And some areas they may have a private STD clinic. The political part of the landscape that I'll discuss, we realize that this is a front burner issue. And in 1976, the Congress created, it was an ODPHP, and that means Office of Disease Prevention and Health Promotion, that plays a vital role in keeping the nation healthy. This was accomplished by setting a national health goal and objective and supporting programs, services, and education activities that improve the health of all Americans. And also, you know that social, economic, and behavioral factors, I also included behavioral factors. The spread of STDs is directly affected by these factors. Such factors can cause serious obstacles. Say, for instance, if someone don't get know that they have STD, then they won't get treated. If they have low economic statuses, then they may not have be able to access care, or maybe not have the willingness to access care. And we have to look at things regarding the sex and sexuality. Also, we have vulnerable populations, um, racial and ethnic disparities. That's if you got low income. Most of them are African American, Hispanics, American Indian, Alaska. They have a high rate of STDs. We have poverty, substance abuse, and sexual networks. And I mean that by if someone is in a monogamous relationship and they're working they on a sexual network, then they start having multiple partners, and then this can increase the risk of STDs. And the legal factors of the landscape is each state must address a system level barriers to timely treatment partners. So we have what's called an EPT, and this means expedited partners therapy, and they have a timely manner to treat chlamydia and gonorrhea. And it's necessary that we coordinate the STD prevention efforts with the healthcare delivery system to leverage new developments and provided by the health reform legislation. And the quality of care, as I said, the local health departments do have to treat, and it's free of charge, an individual with STDs. According to the they have to treat it according to the guidelines for the Center for Disease Control and Prevention, and also the Carolina Public Health Program Manual Policy. All this must be confidential. Also, once they have a suspected STD, they must be examined. They must be tested, and as I said, tested according to the CDC guidelines. Options are crucial to the STD prevention, which includes policy efficacy. National policy decisions include the selection of priorities in the implementation of activities, allocation of resources, prevention and treatment STDs, planning and guidance on a routine service delivery, ensuring sustainability of services, plan specific activities for STDs control, for example, interventions targeted at vulnerable population groups, which I take care of, developing and monitoring training, ensuring that recommended drugs are available, supervision of coverage and quality of services, surveillance systems, and we want to make sure we reevaluate the program.
At a fundamental level, policies are the basis for STD prevention efforts at a state and local public health departments. A 2013 compendium of state statutes that explicitly focus on STDs other than HIV shows that these laws largely focus on establishment of STD programs and clinics, mandatory testing and treatment, expedited partner therapy, referred to as EPT, and confidentiality of STD related records. Additionally, an assessment of state disease intervention laws found that the most jurisdictions have STD related disease intervention laws.
Recommendations. I feel that the national STD committees should continue to provide advice to the STD program policy manager and technical scientific policy-making issues related to the control of STDs. This committee should include expertise on clinical care of STDs, women issues, public health, microbiology, epidemiology, HIV and AIDS, behavior sciences, and health administration, representation of academic and professional organizations, the community and non-governmental organizations that provide STD care should be considered. Also, I feel that no policy should be started on the STDs until we get these STDs under control. Um, Worldwide, as I stated on one of my slides, it's over 1 million STDs infection daily, not just a year, but daily. And it's over like greater than 2 million STDs infections in the USA back in 2017. Policies are important to public health and have a potential to impact many individuals at a relatively low cost.
And I would like to add to this slide for my closing. Antibiotics can cure bacterial STDs, but not always the long-term damage. So as you see, these are some of the pictures that's a result of having a long-term or undiagnosed or untreated STD. Thank you.